Therapy. Let's hear it for Vivie Eisenstadt, everyone. Vivian.
Good morning, ladies and gentlemen. I am a physical therapist, and today I am going to take you all into the mind of a physical therapist by basically thinking out loud. I am going to go through as much of an evaluation as I can in 10 minutes and help you understand exactly what has to go on through my head while you're literally just walking into my office. Okay, so I get a phone call. Now, because we get patients directly off the street, I don't always get a prescription telling me exactly what the problem is. So, and you can't really ask over the phone because of privacy issues. So, you know, some people say I need physical therapy. I go, okay, great. They come in, and you're going to be my patient today. Might as well take off the other shoe because you took that one off. Well, because, okay. So say he has both of his shoes on, right? So the first thing, Greg called me. I need some physical therapy. Walks in the office. So walk in the office. Come towards me. Okay. Okay. He's obviously walking imbalanced, okay? These are the things that go through my head just by him walking in the office. One, male versus female. Men have different physical issues than females do. Females have a higher rate of things called RSD, where if you have an issue, your nerves go crazy. There are different things that men have that women have. So that's the first thing. His age, okay? If he was a teenager, he might have what's known as a growth plate on his bone. And I wouldn't be able to do ultrasound or some of my modalities because they can harm him while I'm treating him. If he was old, does he have osteoporosis? Does he have secondary issues? All those secondary issues that people get when they get older, diabetes, heart disease, things that might affect my treatment of him. Okay, turn around, Greg, I'm still looking at you. How is he standing? How is he walking? He was limping with one foot out, okay? That usually tells me a lower leg injury or lower knee injury, something. How much weight was he putting on it? When he was putting weight on it, was he putting a lot of weight on it? Was he put 25%? Was he wincing when he was putting weight on his foot? Okay, and he still has just walked in the door. He hasn't said a word to me. How is he feeling? Is he happy to be here? Or is he just really exhausted and really angry? I get the worst side of people because they come to me when they're in pain. Who knows somebody that's in pain that's nicer? Not me. So you have to navigate who they're being and how they're doing, and you have to have tons of patience. And not just because he's a patient, but patience. Anyway, don't get me caught on the words. So, okay, he's obviously got a little ankle issues. So then we go through an evaluation. The first thing I do is, you know, patient is a something-year-old male or female with complaints of. And then you ask them for the story. And when you ask them for the story, you're going to get your answer on how to help them. Okay? Is it an immediate event? Did he just sprain his ankle yesterday? You're going to have a different plan of action when you're doing that. If he just hurt himself yesterday, then my first thing is going to be, I want to decrease the inflammation, I want to get it elevated, I want to see which muscles or ligaments have been torn or hurt, how to navigate the swelling, how much pain is he in, if it's something chronic because of an injury. Do we have scar tissue? Do we have compensations like the way that he probably walked for years after having his injury years ago? Emotionally, if it's a traumatic injury, there's a lot of, like a web of how people hold on to their injuries long-term after because of the trauma. He was talking about post-traumatic stress. It's a real thing, people. So am I going to have to, so sometimes people hold on to their pain, like in car accidents and a lot of PI issues that patients that come in. You have to mentally shift their perspective so that they want to get better. So I say to them, everything that you're saying to me and all the pain you're in, I'm writing down. So the judge is going to see it and the lawyers are going to see it. But because I'm writing it down, you don't have to hold on to it. So a lot of times with personal injury clients, their homework for the first day, which is great for their attorney as well, is to go home and write down the story and write down everything that happened and then sit it down and then go back to it a day or two later, see if you left anything out, see if you might have gotten something a little off. So the story, and that way they have it on paper and they don't have to keep repeating it every time they go to a doctor and every time they go to another practitioner. And that way they could start healing, okay? Because it's all on paper, so we all really know what happened. Okay, so Greg comes to me and he's walking a little angsty, and give me a brief history on why your ankle hurts.
Because in '95 I was skydiving and I shattered my leg.
And what else? The hardware.
Oh, so I still got the hardware in, so I got, in my fibula tibula, I still got the plates and the screws and all that good stuff.
Okay, so we have two separate things. If he didn't tell me that he still had hardware in there, we're talking about a whole different story. Because what hardware does is it limits the range of motion a lot. And you have a steel plate, okay? And, doctors try their best. Okay, we're not even getting into the evaluation. Next time I'll get into more. But this is just even the general observation that I have to be thinking about before I even touch the patient or put my hand on the patient. But their story, just by him telling you one sentence, tells me what I need to deal with. Scar tissue. We had a conversation about maybe getting the plates and screws removed. So, for me, it's not about me making the money and seeing people 80 times and then telling him. If he's having a problem that is because he has hardware that he needs to get rid of before that'll go away, I don't act like a miracle worker and tell him I can do it. I'll send him to the best doctor. Okay, so now you had 10 minutes in the mind of a physical therapist. Thank you very much.
We have a moment or two for questions, if we have a question or two.
I have a testimonial to make for Vivian. I was at her place and at her office, and I had a session with her. She has great equipment there. She really deals really good with your body and takes care of you. After I was with her, like maybe for half an hour, I felt like I was in heaven. So you definitely should try her, and she's the best physical therapist in LA. Thank you.
Right on. That's a great one. We have time for one more question if there's one more
Does
question.
anybody have any questions about physical therapy or my services or?
What are some of the stuff, I mean, if you came in there like that and you're evaluating him, what would you put him on? How would you take care of him in that session? What are the things that you?
Well, the goal of the first session is to give the patient hope. So in the first session, we discussed, we would discuss the possibilities of other options with the hardware, but if he wanted to work and see what he can get with me, I'd be doing deep tissue work to loosen up the scarring. We'd be looking at the way he's walking. Sometimes it's not the issue that hurts people, but the way that they compensate and start making really bad habits. So you make a really bad habit for 20 years, then that's the problem and not the original injury. And I'd say about 60% of the time that's what happens. It's not that you hurt your foot, it's that your back went out when you were limping for 20 years. So we eliminate all those issues, and then modalities and exercises and strengthening and homework.
I have a question. I visited your facility, and you have some amazing equipment. Can you just talk for a minute about your electric, I don't know if it's an electric pulse machine?
Yeah, some guy in Santa Monica invented this machine, and he's one of those absent-minded professors that's having a challenge wanting to give it to everyone. But what it does is it puts we're all vibration, we're all frequency. And when you raise your vibration, you shift on every level: physical, mental, emotional, spiritual. And we're just beings that exist on all that at once. So this machine not only releases your neck tightness in 5 minutes, that would take an hour for the massage therapist. So we do a double whammy where you see me and I loosen everything up and put your bones in the right place so that your body gets this first level of release. And then I pass you over to Marcia, who many of you are consistent repeat customers. And I thank you, and I'm in gratitude for your business, all of you, thank you. But then she gets this next level. So it's not like a massage where you go in for a massage and then, a day or two later you might need a new one. We really shift your presence of what your body feels like for a long time in one visit or 2 visits. So my challenge and my blessing is that I do quick work, and my turnover rate's pretty good, but for a good way, because I get repeat customers. But any referrals would be awesome. Thank you for your time.
All right, let's hear it for Vivie, everybody. 2 great speeches today, 2 people very passionate about what they do.